I want to answer the question how long the pain lasts after a total knee replacement. So we have some general guidelines. Of course, everybody is going to be totally different from this, but as a rule of thumb, the first 6 weeks, it's really about overcoming the post-surgical pain. There's the pain from the incision, the trauma from the surgery. There's a lot of mechanical damage that happens to the muscle, the tendons, the ligaments, the bone. And so you're recovering during the first 6 weeks from the trauma associated with the surgery itself. From about 6 to 12 weeks, there's usually a major improvement. The pain becomes far more tolerable and your function starts to improve. You also start to regain some of your endurance, the nausea, lightheadedness. Some people will develop constipation associated with the medication. Most of that diminishes even below the level that is going to interfere with anything you do during the day. Pain and swelling might persist beyond the 12-week mark, but for the general population, about 12 weeks is the standard guideline for the initial phase of recovery. From 12 to, say, 23 weeks, you're looking at continued progress, building strength, building coordination, normalize your walking pattern. But it could be as long as a year that some clients will still have some pain and swelling associated with the initial knee replacement.